My name is Jada, and I did my shadowing at Banner University Medical Center in Phoenix.
So a little bit more about the Culminating Experience. I did my shadowing at Banner University Medical Center with 7 different dietitians for 40 hours. My reasons for shadowing were due to my desire to get experience in the hospital setting as well as outpatient setting, and kind of seeing what it is like working alongside patients. I also already have prior experience in the sports and performance side of nutrition, which is my other area of interest, so I kind of wanted to branch out and address my other interests. I currently work at Banner University Medical Center as a nutrition technician, so I luckily had the connection in with this hospital. I really just wanted to see what a clinical dietitian's job looked like from the day-to-day, different areas of the hospital, and to determine if the clinical setting is somewhere that I could see in my future career. As for my goals going into the shadowing experience, I wanted to determine if this career path is something I could see myself in, and if the clinical setting could be a good fit for me. I also wanted to learn and observe new skills and understanding what the day in the life of a clinical dietitian looks like, while also picking their brain and seeing what the career is like. I feel like you really don't know if you want to take on a specific area of a field of a career if you don't have any idea of what the job consists of. So my goal was kind of to see what the job consists of and if it's something that would be a good fit for me. Another goal I had was understanding individualized plans and how the dietitian approaches each individual's differently. In my sports dietetic internship, I got a taste of what individualized plans look like, so I wanted to indulge in individualization in a clinical setting with a wide range of health conditions. I also wanted to learn how to educate patients effectively and observe how this is done so I'm aware of what does and does not work. I also wanted to learn more about how to problem solve in the environment, kind of observing what different dietitians' problem solving skills look like. Additionally, I wanted to build relationships with the dietitians, creating those connections and getting the most out of the experience. I think learning from their paths to success and understanding differences in job responsibilities in the different settings. And lastly, I wanted to observe the dietitian's healing of negative nutritional habits of one or more patients and what that looked like and how they did so effectively. In terms of progress in reaching these goals and addressing each one, in terms of career desires, I was able to develop understanding of my preference of outpatient over inpatient setting and realizing what is more appealing to me. The outpatient cancer center experience was significantly more appealing in patient relationships and general just job description. I was also able to determine that the clinical setting is not as appealing as the outpatient setting, and I felt that was a huge growth in my career desires and understanding kind of a better route and path that I should take. In learning and observing new skills, I got to observe the process of TPNs in the ICU. I watched a DO2 placement. I got to sit in on updates on guidelines for critical care patients, listened in on a case study presentation of a long-term patient, and many education sessions on nutrition-related topics. In terms of individualized plans, I observed many different patients' plans from ICU, which was more predominantly tube feeding, to renal care, comfort care, cancer care, and a wide variety. Patient education, I sat in on numerous patient education sessions from low-fat diets, low-sodium diets, vitamin K diets, low-sugar diets, and many more. I felt that I discovered how to effectively educate patients for the best absorption of information. In terms of problem-solving skills, I observed how the dietitians used their knowledge, medical history, labs, BMI, current health status, and more to determine exactly what patients needed. Each dietitian performed their jobs a little bit differently, so observing the differences in what worked best for each dietitian was very interesting. In terms of relationships, I was lucky enough to work with 7 different dietitians, and I was able to create some great relationships and connections. I got business cards, phone numbers, and numerous of them told me I could reach out to them with any questions or if I needed any assistance, which was really awesome. The dietitians are really friendly and provided a really great experience, especially since it's a teaching hospital, so they understand how to effectively work with students. in terms of healing nutritional habits. I observed and gained understanding of the importance of nutrition and healing. I was able to observe their education sessions and aiding in the patients to optimal health. The job does seem really rewarding and beneficial to health maintenance of many individuals. I actually learned a lot in this experience. I learned about the impact of medication and how some medications can block proper absorption of different vitamins or minerals, and how nutrition can be closely monitored when paired with numerous medications. As I saw, medications do not always allow for optimal nutrition absorption. As for TPNs, I learned about TPNs and the complexity and importance of accuracy and having the knowledge of a variety of nutrients for specific needs for individuals. They're very individualized, so that was very interesting. I also learned how blood sugar can typically raise while in the hospital for many different reasons. And within the normal levels range is higher than the typical within the normal glucose range. I also learned that the job is experimental and very in-depth research on patients has to be done in order to create a perfect individualized plan for optimal health. I also observed a duo-tube placement and got a better understanding of different types of tube placements, which was very interesting. As for critical care, I got to sit in on an hour-long meeting on the updated approach to critical care and the importance of protein on critical care patients. I also got to learn a little bit more about the importance of protein on individuals who are healing and those whose bodies are going through stress. I did realize that protein is important, but protein plays a significantly larger role in recovery than I realized. I also sat in on a dietetic intern's case study and got to learn about the presentation process as well as an in-depth patient case. I got a little bit of a sneak peek into what the dietetic internship will look like, which was really awesome. I also learned about the importance of nutrition in cancer, especially during treatment, before, during, and after treatment, which I don't think the average person really realizes how important nutrition is in preventing cancer and during the treatment process as well as post-recovery. Overall, I felt that this shadowing experience was an application to my future career. I was getting to see these firsthand what a day in the life of a dietitian looks like, and clarifying my passion for the field of nutrition makes me more excited for my future. Additionally, observing day-to-day skills and getting to see different fields of clinical nutrition was really awesome. I also gained understanding of what the fields and setting preference I prefer, and overall I felt great growth in my career through this shadowing process.